Hello, I'm Sue Chun, student nurse of Western Sydney University. This presentation of health variation 1 subject is about Mr. Nicholas' post-operative care after underwent retropubic radical prostatectomy surgery due to diagnosis with locally advanced prostate cancer. This presentation aims to disseminate nursing practices to help consumers about post-operative cares. So at least 1 in 5 men is likely to diagnose with prostate cancer by the age of 85, with approximately 28,868 cases in Australia since 2025. So what is prostate cancer? Prostate cancer refers to abnormal growth of malignant tumor cells growing from a walnut size and enlarging into an uncontrollable size inside the prostate glands, peripheral zones of male reproductive system, spreading to lymph nodes and visceral organ, causing urination difficulties, incontinence with blood, and life-threatening episodes due to urethral compression. So what is the surgery? Retropubic radical prostatectomy is a surgical procedure removing the entire prostate glands and seminal vesicle, bladder neck, pelvic lymph nodes to treat prostate cancer, usually one long cut of the abdominal incision. How does prostate cancer develop in human? The pathophysiology of prostate cancer develops when the alteration of p53 protein transfection system deactivates apoptosis in the prostate gland's peripheral zones. The inflammatory cells ingest basal cells and creating prostatic intraepithelial neoplasia and damages to the DNA via gene mutation and bone metastasis. Apoptosis is the cell death program, and p53 protein's role in apoptosis is to grow, repair DNA, and inhibit genetic mutation. Nicholas' prostate cancer is graded as stage 3 cancer due to his Gleason score at 7. In this case, the intraprostatic conversion of testosterone to dihydrotestosterone activate androgen receptor and enlarge malignant tumor metastasis to pelvic limbs, seminal vesicle, bladder, and his prostate gland. Constantly, the cellular stress triggers genomic instability and fibroblasts, causing alteration to AKT kinase signals, activating gene mutations of the androgen receptor AR on the X chromosome, resulting in prostate malignant metastasis. So what are the risk factors? Nicholas' modifiable risk factors, including his unhealthy intakes of plenty caffeine and excessive UV radiation exposure during intensive cycling hobby that increases his androgen level, elevating cancer metastasis after diagnosis. His non-modifiable risk factors, including a deterioration of gene mutation, compromise immunity against cancer, his family history of cancer, his PSA level is 7.5 nanogram per milliliter, and Gleason score is 7 after blood test and biopsy with a detection of a firm malignant after digital rectal examination. In this case, Nick's locally advanced prostate cancer is metastasized to his lymph nodes and bladder. So what are the pain managements? Paracetamol is a non-opioid analgesic medication, commonly relieves short-term pain, reduce fever, and arthritis. Paracetamol inhibits prostaglandin synthesis by the activating enzyme cyclooxygenase 3, COX-3, in the brain and spinal cord to command analgesic and antipyretic effects, reducing pain and fever. However, paracetamol contributes into hepatic first-pass metabolisms, trigger liver alteration to hepatitis patients. Paracetamol has lower affinity levels with mild side effects like nausea, sign of inflammation, skin necrosis, and rare hypersensitivity, which makes it safer to administer for post-operative pain. RN must monitor patients' allergy reactions, side effects, and drug interactions, importantly avoiding anticoagulant combination to prevent hemorrhages since catheter can occlude with blood clot. They conduct vital sign ATG assessment to check temperature, skin integrity, incontinence, sign of infection or sepsis, and prevent constipation or burn urination. After the surgery, the patient is commonly nothing per oral, and RN must administer paracetamol wedge tube in a gushing powder form to improve safe appetite based on dosage requirements and patient swallowability, adhering to consents on patient's drug dependency and tolerant history to ensure safe drug-food interactions. RN also consider patients' hepatic and renal function based on their age and blood tests, aiming for serum creatinine less than 2.6, safe pH resuscitation, blood glucose level, and liver function prior to administration to prevent adverse drug reaction or liver damage. They will educate family patients about drug side effects if overdose, activate charcoal, safe environment, bed calls, and record intake or output detail to regain patient's continence. The PCA is patient control analgesic. Allow patients to self-administer intravenous opioid analgesic, where self-rest button with an automatic locking control system to prevent overdose. Apply ice pack or heat pad is the non-pharmacological intervention. Temperature is central to post-prostatectomy patients' vital sign to prevent sepsis. Apply ice or heat less than 20 minutes to avoid burning or overcompensating. Applying ice pack at inguinal area, avoiding surgery site, can cool down pyretic sensation to numb the pain, soothing and moisturizing skin from inflammation or hot flash side effect, easing vasoconstriction of bladder spasms, and relaxing nerves. Heat pad can reduce swelling by thermalizing skin to reduce blood clot related to wound ulcer, easing vasodilation of bladder spasms, and reducing gastric discomfort. These methods ease physical and emotional pain through sensation, temperature sensation, touching skin to distract pain sensory receptor, reducing hormone reactivity, which is more effective compared to other destructive non-pharmacological interventions. Patient amygdala activate hypothalamic impulses to biomedical pain suppression better than biopsychosocial pain destruction. What are the wound managements? The two priorities post-operative wound care are ostomy bags management and wound dressing, are significant to prevent infection, to reduce side effects, improve continence, and facilitate recovery. Ostomy bags management involves draining and disposing urostomy bags and wound drainage bags. At least 2 weeks for patients to have urostomy bags with invalid urinary catheter IDC join the bladder and urethra heel to drain out urine from bladder through penis. At least 3 days are paid for patients to have wound drainage bags to drain out excessive fluids from the abdomen, including edema and cerebral fluids via plastic tubes. RNs persist patient drainage bag below abdomen level, enclosed with caps to safely empty, dispose, and document outputs as required. RNs persist patient comfort, feeding, catheter removal, bladder scan, and pathology referrals for blood tests and urinalysis if needed. They will record vital signs, intakes, maintaining safe environment with sensor alarm for avoiding mobility with oxygen. For wound dressing, RN must consent document prior for wound cleansing with sterile solutions with antiseptic technique, equipment sterilization, applying cotton balls and gauzes to protect wound sites, followed by infection control precautions to ensure the surgeon's wound is clean, dry, and tidy. RN consider correct pad size selections, adjust comfort positionings to reduce abdominal activity or bed bound, ensuring no urine in the dressing. RN conduct skin assessment to check signs of infection, swelling, bladder irritation, skin fibrosis, blood clotting, and pressure ulcers prior to pad changing to absorb patient's fluid to prevent infection and enhance their continence. They hygiene patient inguinal with antiseptic transdermal lotions, leg massage to improve capillary refill, wear sock compressions to prevent blood clot after wound dressing, ensuring IDC and IV priming are tidy labeled with expiry dates without clogging or infection. And what are the patient educations? RN work in multidisciplinary team with oncologists and rehabilitation specialists for Nicholas recovery using therapeutic communication and cultural safety practices. They collaborate and refer to occupational therapists for breathing, physiotherapists for PJ exercise, psychologists for mental health, allied health team, and paramedic for mobility and transportation. They hand over to pharmacists, dietitian, pathologists, and urologists for patients' medication, nutrition, blood tests, and urinalysis, respectively, to observe postpartum spread. Prior to next discharge, RNs will educate patients on wound care to keep it clean, dry, and tidy, plus guidance on pad selection and set drainage bag management at home. Nutrition advice must avoid smoking, alcohol, caffeine, high-fat red meats, and vitamin A, replacing with vitamin E, selenium, tomato, pink grapefruit, watermelon with high lycopene, cruciform veggies, and green tea to repair the DNA. RNs encourage hydration where liberal fluid intake of 2 to 3 liters per day only, and educate medication side effects, constipation prevention, lifestyle changes to avoid holding urgent urination or wearing tight pants, and informing remission period in hospital stays. Physiotherapists also recommended that Kegel pelvic floor exercise improve continence since body mass index elevates post-cancer symptoms. RN educate family patient to check vital signs at home, mobility, feeding, positioning, and hygiene to apply antiseptic cream to his groin area, deliver pulse oximeter and regular record of intake and outputs. RN will listen to patients' biofeedback, referral to counseling for mental well-being to prevent post-treatment regret, like hair loss, infertility, and menopause are side effects from potent chemotherapy. Outpatient system include transfer of care, follow-up appointments, specialist referral, transport advice, and post-operative discharge summary and nursing consideration for patient education. References are available upon request, and thank you for watching.